when you got a needle in the uterus, you could hit the baby. And I'm telling you, there were times when you could feel the baby move or move
Wow.
away. So
Wow.
don't tell me they can't feel pain, because at
Mm.
16 and 17 weeks, I had plenty of cases where you can't tell because it's blind. You hit the baby and the baby pulls away. You can feel it.
Do you recall the first time you performed an abortion, either in residency or when you were a doctor? Did you have any qualms with that, or again, just a procedure?
Well, I don't remember. I don't have a clear
Hmm.
present memory of my first abortion. I mean, I've done enough of them to know exactly what happened. When you're doing a first trimester, think about, for your audience, first trimester, the pregnancy is divided into three trimesters, about equal sizes. Pregnancy lasts 40 weeks, not 9 months. We don't talk months in OB. And the first trimester is up to 13 weeks from last menstrual period. We count from last menstrual period. And yes, we know you weren't pregnant back then, but that's how we count.
Okay.
And a 12-week baby is the width of your hand from head to rump, not counting the legs. That's the size of a
Okay.
12-week baby or smaller. And you use, in fact, I have one here. You use a suction catheter. You put it up through the cervix. This suction machine is turned on. The suction's quite strong, and will literally tear the baby apart. And these pieces will come through the tubing into the machine. So when you're done with the procedure, you have to open the machine and look, and then you have to check and make sure that all the pieces are there. You have to make sure that you got
Hmm.
two arms, two legs, and all the pieces. That's important. And we'll talk more about that later when we get into second trimester abortion. That's a whole different deal. But that's essentially what a suction DNC is. And we didn't have medical abortions. We didn't have chemical or RU46
Hmm.
abortions at the time. It was, first trimester, suction DNC. And I did a lot of them. I mean, it's interesting. When it was my turn to do them, I would do, believe it or not, we did them in the delivery room. And
Wow.
I would do 2, 3, 4 in the morning, never thought anything of it.
Hmm. Wow. It's somewhat telling the fact that you don't remember the first one just shows that it wasn't really a moral qualm for you. You didn't have to get over it. It was just a standard procedure. Okay. Now, I was going to we jumped in a little bit, give maybe like a trigger warning for folks. I figured they would know if I'm talking with someone who's an OBGYN former abortionist that we're going to get into some of the details here. So here's their official trigger warning. We're going to start talking about in a moment some of the very procedures because people need to understand exactly what's going on. Now, before we come back, a couple questions before we jump into that is you would do 3 or 4 a day. So how long was this span over that you performed abortions? How many
Well,
years?
I was doing 3 or 4 once, maybe twice a week,
Oh, okay.
depending on, how many. It wasn't an everyday thing.
Okay.
And my OBGYN training proper was 3 years.
Okay.
So, you can make a guess at numbers.
Okay. So how long ago was this that you stopped? And we're going to get to the story why you stopped, but how long ago was it that you stopped?
I'm not sure I understand what you mean. How long
That
ago? I
how
quit
many
doing
years
abortions.
ago? Yeah.
Okay. I quit doing abortions in 1985.
Oh, 1985. Okay. Got it. That
February
makes sense.
1985 was the last abortion I did.
February. Wow. Now, so you remember the last one with clarity, and we're going to get to why that was so distinct as opposed to the first one. That's very, very telling. Okay. So, have you ever had an abortion that was botched? In other words, the baby was born alive. And
Oh,
how did you
okay.
deal
That's
with
what
it
you're
if so?
in my case, no.
Okay.
I was doing suction DNC abortions. I mean, remember, a baby this big or smaller cannot live outside the womb.
Hmm.
And when you're doing a suction DNC abortion, you're tearing the baby apart. The machine in that
Hmm.
case is literally tearing the baby apart. There's no chance of a live baby coming out. The second trimester abortions. Now, let me talk a little bit about the history of abortion real quick.
Okay.
Um, Prior to 1980, 1980, 81, when we were doing beyond, as I said, first trimester up to 13 weeks. Second trimester is 13 weeks to 27 weeks. Abortions were possible up to around 23, 24. They started getting too difficult after that, and they were pretty rare at that time. at those much, much later stages. But of course, now let's go by comparison. We said a 12-week baby was the width of your hand. A
Mm-hmm.
20-week baby is the length of your hand from the tip of your middle finger to your wrist.
Mm.
That's head to rump, not counting the legs, a 20-week baby, one that is halfway through pregnancy. And we were doing them beyond that. Mothers feel their babies kicking between right around 20 weeks, 18, 19, 20 weeks, actually feeling the baby kick at that point. So
Okay.
you've got a very fully formed charge and a child and a big one. Um, the trimester framework was important because that's how Roe versus Wade operated. And again, I won't get into that unless you want
Sure.
to. Right now, with the Dobbs decision, I love these news reports. Well, the majority of people are polled say they favor having Roe versus Wade reinstated. The majority of people have no idea what Roe versus Wade even says.
Hmm.
The majority of people favor first trimester abortion, but not what Roe allowed any abortion anytime for any reason, essentially. And of course, there are states and politicians who champion that today. When you're doing a D&E abortion, well, anyway, let me finish what I was saying. So after 13 weeks up to a little bit past 20, what we were doing initially in my training were saline abortions. You would put a 20% salt solution, it was very caustic. You would draw fluid out from the uterus, you would place saline solution in, and I did these in my training. And then you would wait for the patient to go through labor. There was no instrumentation involved, and these women would have to labor anywhere from 8 to 36 hours to
Wow.
deliver their almost always dead children. Now, I
Wow.
personally never had a live birth. There were a
Okay.
couple of them at my hospital, however.
Mm.
And of course, once a baby's born, that now is a person. Interesting. People confuse. You and I are human beings, but we are also people, you and I. But they
Mm-hmm.
are not the same, despite what people think. You're a human being by definition of science. You're a person by definition of law. Totally different universe.
Hmm.
And the difference is a person has rights. And when did you acquire those rights? Well, when you became a person. And when did you become a person? When you were born. This is the legal justification for abortion. Forget the morality, that's the legality of it.
Right.
So once that baby if you did a saline abortion, or maybe we rarely did what are called prostaglandin abortions. We didn't like those because you got more live births, so we tended
Mm.
to avoid them. Um, Now, once that baby drops out, now this is a person and has rights, and you have to try to save that child, at least legally and morally, you do. And that happened a couple of times in the history of my hospital. I never had a case like that myself.
Mm. You didn't have a case. Okay.
Mm-mm.
So you perform most were kind of the suction in the first trimester. Do we know if babies at that point can feel pain potentially?
It's controversial. I
Okay.
don't know that anybody can prove that they do at that stage.
Mm.
Now, remember, I said I was doing saline abortions. Of course, the nervous system is developed, it's developing. You've got a heartbeat, you've got the baby's moving. You can see the baby moving starting at 10 weeks.
Mm.
Well, it takes nerves, it takes active living nerves to do that.
Mm.
And all I can tell you from personal experience is the salines, most of the salines I was doing were 15, 16, 17 weeks. And remember I said you put a needle into the
Mm-hmm.
uterus and you draw fluid out and put salt solution in. Well, you're putting a needle in where the baby's in there where the needle is. And you ever gone fishing, Sean?
I
When
have.
you've got a bite, you can feel
Mm-hmm.
it. If I took a needle and stuck you, you'd pull away. You might hit me, but the
Mm.
babies don't have that option. Okay, but when you got a needle in the uterus, you could hit the baby. And I'm telling you, there were times when you could feel the baby move or move
Wow.
away. So
Wow.
don't tell me they can't feel pain, because at
Mm.
16 and 17 weeks, I had plenty of cases where you can't tell because it's blind. You hit the baby and the baby pulls away. You can feel it. So there's a lot of controversy about that. I won't say anything more about it.
That's fine.
Um, on the other hand, I'm going to editorialize here for a second. People talk about, well, in a way it's harsh, but I would say, if you're having an abortion, why do you care if the baby feels pain? You're
Mm.
killing the baby. You're doing it deliberately.
Mm.
Well, it's more humane that way. Interesting comment. So my take on that is, okay, imagine you're asleep in your bed and I break into your home, but I do it very quietly. You don't hear me. And I lay and you're fast asleep and I lay a shotgun next to your head and you still don't wake up. You did not hear me. And I pull the trigger. I promise you your death will be painless.
Hmm.
Feel better about it?
Hmm.